Good morning, good afternoon, everybody. Good afternoon. I'll give it a few minutes before I let everybody do it. I'll give people coming in. Today's discussion is going to be Aaron Hernandez. Aaron Hernandez and CTE, which is chronic traumatic encephalopathy. So we're going to do Aaron Hernandez and CTE today, basically chronic brain inflammation and the impact it can have. Um, so we give it a few more minutes to let some people come in. Hello, Mohammed. How you doing, buddy? Dylan, how you doing? Okay. Dylan comes with the questions early on. How about you answer those questions for me? How about you? You please feel free to answer those questions for me. How you doing? How you guys doing? Hey, Doc. How's it going, Doc? So let me just give you some updates. Um, Next month we'll be opening our walk-in clinic, 8 to 8, 8 a.m. in the morning to 8 a.m. at night, and hopefully we can get it to the point, staff it to the point where we'll have it going at least 7 days a week. And this will hopefully allow my patients to sort of gain direct access to me, and hopefully it can facilitate more communications. Also, we'll be facilitating direct admissions from home and from the outpatient walk-in clinics. And so, if you need any type of mental health services, you can still contact me or my clinic or online, and we'll be able to provide those services for you. So that's coming up soon, an online clinic and a walk-in clinic. Second, if you're a family practice doc or internist interested in working with me, yeah, please contact me. I think there's a lot of, we're going to be introducing a lot of innovations in this space, and a lot of things are needed in the space of mental health. So hopefully we can address some of those needs and provide, and hopefully I can start providing more services to my patients and their families. You know, our team does a lot to try to improve the care for our patients, and most importantly, we try to give the best care possible. So we show up every day very early, ready to try to meet the needs of the families and the patients. And it's a challenge. It's a challenge, but it's something that we enjoy a lot, and we've been pushing very hard to improve the care where we at and to provide patients with the highest quality of care. So oftentimes we do a lot of neuropsychiatric assessment at the bedside to assess brain injuries and brain lesions and things like that. And it helps us build more of an evidence-based model, so that we can make our decisions. And I believe that our care is the standard. I just believe that. I think that our providers we work with are great. I work with the best nurses in the world. I got a phone call. Hold on a second. Hey, can I call you back in like 30 minutes? I'm on a podcast live. Thank you so much. Okay. I work with the best nurses ever. And so we give a lot of very good, we've been working together for a while. We get a lot very good treatment for the patients. I think our patients are very satisfied with the care we give on the behavioral health unit. And if we can't, something we can't do, let us know so we can learn quickly and start delivering better care. So we are desperately trying to improve the care of our patients, the patients in this community. And it's very important that our patients have access to us. And so if you're a patient of mine, I give you my number directly. Just call me directly or text me. So I do get quite a few calls. And I think our patients understand that we are working very hard to improve their experience in here. Um, so this audience is primarily of medical students, of doctors who finished medical school, people who are in their residencies and training. So it's a full range of students at on various levels, nurse practitioners, and sometimes I may have college students and things like that. And so it gives me an opportunity um, to teach a full range of people. That's really good. So and also, we're going to be sending these videos out to the patients and to the families. And so, if there's a patient or someone diagnosed with chronic traumatic encephalopathy or CTE, hopefully this can help you get more information about it. Okay, and so let me go ahead and begin this discussion on CTE. First, I would like to bring up the this gentleman here. His name was Aaron Hernandez, and Aaron Hernandez was a professional football player. Um, this gentleman here, he's a professional football player, and it's thought that over the course of his football career, he had so many head injuries that he developed inflammation, chronic inflammation. And as you're going to see, inflammation in the brain, although it's used to serve its function and repair and things like that, but the inflammation causes other type of problems that's very difficult for people to handle. So let me look at Aaron Hernandez here, and I have this Wikipedia page here. Let me just see what's happening here. Okay, Aaron Hernandez. Okay, was an American football player who was a tight end in the NFL. He played 3 seasons with the New England Patriots. 3 seasons with the championship Patriots. So he's on the top tier in professional sports until his arrest and conviction of Odin Lloyd. Okay. I couldn't imagine someone going from the Super Bowl to prison for murder. How do you do that? Um, he played for the Florida Gators. Okay, he was on the All-American team and did pretty good. Due to concerns towards his size and off-field incidents, wow, he was not selected until the 4th round of the NFL round in the 2010 draft by the Patriots at 20 years old. So at 20 years old, he may have been exhibiting this behavior that they described as incidents. One of the most dominant tight ends. The first pair scored at least 5 touchdowns in each consecutive season on the same team. 2013, he was arrested and charged with murder. Okay. A semi-professional player who was dating the sister of Hernandez's fiance. Following the arrest, Hernandez was immediately released by the Patriots, was found to be guilty of first-degree murder. And in 2015, he was sentenced to life in prison without the possibility of parole. While the trial for Lloyd's murder went on, Hernandez was also indicated in a 2012 double homicide. But he was acquitted after the 2017 trial. 5 days after being acquitted of the double homicide, Hernandez was found dead in his cell, ruled as a suicide. His conviction for Lloyd's murder was initially vacated under the doctrine of abatement or whatever because Hernandez died during the appeal. Anyway, let me just go through this history of abuse. It may be significant here. It is significant. Hernandez remembered his mother throwing his father out of the house on multiple occasions, but always letting him back in. The father pushed him to excel through sports, but was also abusive towards other boys and his mother. The beatings Hernandez gave him and his brother were sometimes for no reason at all, or were alcohol related. It's emotional, psychological abuse. Yeah, physical abuse. Hernandez became estranged from his mother. Isolation. Okay, so we got some history in the background, Aaron. Okay, let me look at CTE. Chronic Traumatic Encephalopathy. CTE is a progressive neurodegenerative disease caused by repetitive head trauma. And they thought the repeated concussion is primarily linked to contact sports like football and boxing. We reviewed the one on Muhammad Ali. Inflammation probably destroyed his basal ganglia that created the symptoms of Parkinson's disease, right? As well as military services. Okay. CT is characterized by the buildup of abnormal proteins called tau, right? Those, which disrupts the brain function and lead to a range of cognitive, behavioral, and mood-related symptoms. Remember when we discussed the role of inflammation in the brain and how challenging it could be when you have inflammation in the brain. The reason why is it disrupts the blood-brain barrier, and the blood-brain barrier is the security for your central nervous system. If you have these gaping holes in your blood-brain barrier, then the area where you're getting the infusion of all these products will likely interfere with the functioning of the brain, the nerve cell at the level of the synapses or something like that. But it's an area that could be contaminated, so the machinery simply doesn't work right. And if it's chronic inflammation, then you're talking about this process happening diffusely throughout the brain. Now, in the case of football or boxing, you get the head injury, the inflammation, then the inflammation can promote more damage to the tissues. So the inflammation itself can result in more injury or exacerbate the current injury. So let's look at CTE. The cause, repetitive head impacts. Okay. The symptoms, memory loss, hippocampus, remember? Right. If the hippocampus is inflamed or damaged, it's not going to encode as much information. If you don't get as much information in your memory, how does your brain process it? It's going to process what it has, not what it doesn't have. And when your brain renders a reality for you, it's going to render reality based upon what it has, not what it doesn't have. So memory loss, confusion. Why? You're not getting anything into your memory. You won't have an updated version of reality going around you. You have the previous one that was outdated. You'll be reacting to an outdated plan that your brain hasn't updated yet, and you won't even know it. Difficulty planning and problem solving. Remember that prefrontal cortex, abstract reasoning, mood changes. Remember that mesocortical pathway and things like that? Depression, anxiety, irritability, this mesolimbic system here and damage there. Impulsivity, aggression, the frontal lobe damage, the frontal lobe release and the aggression we get, and then eventually dementia. If this swelling the inflammation isn't brought under control some way, then it'll lead to just continued damage. This chronic inflammation is not good. Okay, progression. CT is a progressive condition, meaning the symptoms work over time. Chronic inflammation, reoccurring, repeated exposure to blood-brain barrier malfunctioning, of course, it's going to continue to feed on itself. Diagnosis, tissue analysis, and autopsy. And I think they did for his too. Let me see if they actually was this his okay. So was a CTE diagnosed at autopsy? Yes. Aaron Hernandez's CTE was made during autopsy. CTE can only be diagnosed after death, okay, through the microscopic examination. Wow, okay. The autopsy revealed that Hernandez had stage 3 CTE, one of the most severe cases ever found in someone his age. Stage 3. Wow. You know, I think we're getting to a point in our society where activities that damage people's brain, I think there should be um, um, a legal remedy for this. Like if I participate in this sports for high school and college and I have my brain damaged for your entertainment, I should be able to get reimbursement from the school and university. Things gonna get to that point because creating brain damage for people who need their brain is awful. Okay, so yeah. All right, let me see here. So here, so here's a question here. I want to look at the mechanism for the cerebral inflammation. Okay, cerebral inflammation or neuroinflammation is a complex process. Okay, involving the brain immune response to injury or infection, right? Often characterized by activation of glia cells like microglia and astrocytes. Okay, so the inflammation activates glia cells. These cells release inflammatory mediators. Yep. Cytokines, reactive oxygen species, like radical oxygen, something like that. I think that's why you take stuff that binds radical oxygen, a radical reactive oxygen species, is because they can result in inflammation, which can both be beneficial in short term because it helps repair the situation, but detrimental in chronic cases. Okay, look. So triggering infection or injury pathogens such as bacteria and viruses and physical damage of the brain can initiate the inflammatory response. Okay, so we're thinking physical. I think if a person had um, um, uh, like a CNS infection, like tuberculosis, something like that, TB. Okay, systemic infection, inflammation signals from other parts of the body can cross the blood-brain barrier and activate brain immune cells. These damage associated molecular patterns. Okay, so these are the triggering events. Okay, and here are the components that create the neuroinflammatory response: microglia, astrocytes, the blood-brain barrier, like we saw. The mechanisms: cytokines, these interleukin factors here, chemokines, reactive oxygen species. I forgot these. It's been a while since I looked at these too. All right. So anyway, cytokines, chemokines, and reactive oxygen species. Um, the consequences of the chronic inflammation. Um, Here it is: neuronal damage. Yep. Disruption of the normal function. Yeah. I think that's what happened in Aaron's case. Therapeutic, target the inflammatory responses. Yep. Protect the blood-brain barrier. Modulate the immunochemistry. Let me see. There's another question I had here. How many concussions would create Aaron Hernandez's condition if he had stage 3? How many concussions would? So when you see those YouTube videos of teenagers fighting in bathrooms and things like that, knocking each other out in football games, awful, awful, and all this stuff is just brain injury stuff. So here, it's impossible to say definitely how many concussions will create a specific degree of symptoms similar to Aaron Hernandez's case. In CTE, his CTE was severe and attributed to repetitive head traumas, but the exact number of concussions or subconcussion hits that lead to CTE is not known. And here's the reason why. When your brain, your skull is a bony cavern, and your brain is a sponge. Now, when you put a helmet on top of that, the helmet protects the skull, but I think it may have an impact of trying to dampen the delivery of force from the outside surface of the helmet to the inside surface of the skull. I think the cushions try to absorb all of that force so that inside the skull it doesn't impact the brain that's like a sponge. But if you are hit, like in football, it's a huge jarring of the whole brain. And so you can get jarring forward and jarring backwards, and a rotational force where the brain rotates on the spindle on the stalk, and that rotation on the stalk can create damages to the internal structures, the deeper structures of the brain. So let me try to send you through some of these, like with CTE. Let me look at first some of the just general symptoms here. Management, the cognitive symptoms, of course. Okay. Like the ones in Alzheimer's. Remember, we're going to use that eracetamininda, those cognitive enhancers targeting acetylcholine, right? The behavior and mood symptoms. Remember, we use dual mood stabilizers, Depakote lithium, on a regular basis. And then sleep issues. And these are all the other things that they're going to have to improve on. But let me look at some of the type of damage that you can get in football that will lead to this CTE. And many of the times we don't really know that some of these kids have these injuries, and you don't really know they're going on. So this is the imaging in chronic traumatic CTE and traumatic brain injury. Let me just go through a few of these. Okay. Okay, so this is a case where you have a subarachnoid hemorrhage, and that is blood, a blood bleed in the arachnoid space here. Okay. Brain contusions where the tissue is damaged itself, right? When you have two football players going on head to head, and I think they banned head-to-head hits. I think you have to like roll and stuff like that. But I think they banned head-to-head hits because of that in football. But when these two helmets get together, the brain simply bounces, hit the front, creating a contusion. That's a coup. And then it bounces back, which will create a contra-coup injury. And so you can get contusions based upon coup and contra-coup injuries based upon how the person is hit. Okay. Diffuse axonal injury. You can shear layers of the brain. If it hits a certain level, you can shear the levels and break the attachments, the neuronal attachments that are going from one layer up to another. So there's a way to create significant diffuse axonal injuries with these. I don't want to show it there. Acute secondary brain injuries like bleeds and things like that. Remember, chronic traumatic brain injuries, the chronic inflammation. Let's see here. Okay, so it gives you the different types of injuries you can get from a head injury playing football or something like that. And these things, if they don't get a CT scan, these things could be happening. It could be going on and never know about it. So remember, if a person gets a concussion to the point where they're unconscious, that's a head injury. They're unconscious. It's a head injury, and you may not pick up the extent of the damage until 10 to 15 years later. So if Aaron Hernandez, I think he died at age 27. And so he has stage 3. So he could have been getting injuries hurt early on in high school, elementary school. And if those things weren't detected or treated, I can see how it can easily lead to something like this. Okay, so here, let me see if I can answer a few questions. And so if you have any questions, please feel free to let me know. I'll be glad to answer them. Okay, for Dylan, how you doing, Dylan? Thanks for the see, I really don't work with those medications as much because I don't really see this as much in my population. So I will refer that to these medications to people who do this more of a living. I don't really work that. I use more, my approach is to sort of try to do the neuropsych testing to identify the specific lobes and the networks that are malfunctioning. If I can track the malfunction to a particular network, then I look and see what my receptors are on the network. Then I know what I want to do with the receptors, so I can sort of trace that back and sort of figure out what medication I want to use. And the medications will have certain properties because they'll be binding different receptors at different propensities and things like that. So I sort of like reduce it down to the individual receptor profile networks and then try to build up from there. And so I sort of use the medications based upon their molecular properties, not what they're branded for. Okay. And so I can see cases where I can use those too if I want to impact those targets. But in the process of stabilizing mood, we have the medications that's most effective for those. The ones who stabilize in cognitive functioning, like acetylcholine, the cognitive answers, I go with those first before going to things like amantadine. Okay, next, Dylan. Thanks for the question, Dylan. Appreciate it. Do you have any courses, Dr. Reed? Is there any way to become a student of yours? So this rotation, this lecture series here is primarily for the students I'm teaching. You can just contact my boss. Her name is Isabella and stuff like that. And just send your information. How am I going to get in touch with you? Send me your, just contact me through, I'll find a way to get your number. I'll have get your number. Okay, let's see. Any other questions? Okay. Thank you, Hash. How you doing? Can athletes protect themselves without ending their careers? I believe our society is changing. It's changing a lot. I mean, I think it's changing at the core. I think we've matured a lot as a society. And I don't think that, and I think for sports like baseball, like football, I think women women are like more viewers than men. And as viewers, I don't think that they accept the type of men. I don't think they want. I think they want their heroes to be real heroes and not people who are pretending to be heroes. And I think this is a hero finding process. So I think that the brutality in sports like the 80s when they were hitting people hard, knocking people out on the fields, and then remember like in hockey where they'd be fighting each other and blood be coming out. This is just nuts. So I think that women became more viewers, and I don't think they like those things anymore. So head-to-head collisions are stopping. I think they have to wrap. I think there's whole safety procedures involved in professional sports now, and I believe it's trickling down to college sports, and I think it's at the present of high school sports now. So I think you get a penalty from hitting someone head on that much, and so I think that's the industry is changing. So I think the field is going to be safer. Okay, let me see next one. How does chronic brain inflammation develop after repeated head traumas? The head trauma creates injury. The injury causes the microglia cells to secrete the interleukins, in inflammatory meetings, the cytokines and the interleukins, and they result in the opening of the blood-brain barrier pore section. That results in the other immune systems and other products entering the cerebral CNS. And that's one of the issues that creates the problems. And if it's chronic inflammation, it goes on and on and on and on and on, and you can get a continuation of brain cell death that occurs for at least a decade. So you can get the impact of that damage approximately 12, 15 years later. Okay, let me see. Next question. Why is it underdiagnosed despite so much research? You have to get a CT scan on every one of these little kids in high school students. So I think they just test them. If they're dizzy, they sit out the game, and then they have to go to the doctor. If they're not dizzy, if they get hit hard, not dizzy, they can play again if they're dizzy. And then I think many of the sports have a physician there. I remember doing that type of work and everything, doing it with football teams and things like this. Very interesting. Traveling football teams, very interesting. Okay, next question. Let me see. If players know about CTE, a priority, but play anyway, why should they be compensated if CTE is actually does care? Yeah, Charles, you got a really good question. I just think that entertainment that injures someone's brain shouldn't be, that's my opinion. It's not entertainment. I don't think it's entertainment. Entertainment shouldn't permanently injure you shouldn't be permanently damaged for someone else to feel good about viewing something. But I think I think the most responsible thing to do is for them to have after 20 years, for them to have a way for the courts to address the disability they have for him, for this unfortunate 27-year-old man to lose his life like this. And he simply was attached and preoccupied with his craft, things like that. I think him and his family should be compensated from that. They should, in my opinion, it should be from the NFL. You know. Uh, anyway, nobody's listening to my opinion. I'm a psychiatrist, not an NFL owner. Hey, Dr. Alex Sierra, it's been found that of the 376 former deceased, wow, isn't that amazing? Mm, isn't that amazing? If you think about like ancient Rome and the Colosseum, where they would feed people to lions and they watch people get torn apart and things like that. Um, I'm not sure how that's any different than watching something like, for me, watching someone like this, particularly in boxing. I just can't watch another person get damaged like that and just laugh at it. Oh no, absolutely not. But yeah, Dr. Sierra, thank you so much for that point. I think it's very interesting. Thank you so much. Okay, who else we have? Okay, we have Felipe Furlan. I remember when me and Felipe was in South Africa carrying equipment down the middle of the street. Hey, Felipe, what's going on, buddy? Hi, Doc. Wow, I can imagine how this athlete can be hurt in the league. Yeah, and then you know what? There was a sad story about, and I don't know how much of this is true, that in order for his daughter to get the insurance policy, he had to like end his life or something. It was just awful. The whole storyline, you read something like that, if you just look at that, and just awful. Okay, next is let's see here. Oh, Dr. Liv. Hey, how you doing, Doc? As a former professional soccer player, now that's tough. Soccer, you running a lot. Former professional soccer player, that's a lot. Um, there was a time when they tried to implement headgear due to the risk of concussions, but hitting the ball. The implementation, while introduced, didn't pass. Yeah, that's one of the things that one of the concerns that, okay, now they now have restricted hitting until soccer players are 12 plus, right? But the relationship between hitting the ball, oh, heading is when you bunch your head on the ball. Yeah, because she's a professional. Right now, they have restricted heading until age 12, right? But the relationship between heading the ball and CT continues to be under scrutiny as not proven, like in MMA and football. Wow, that's because that's a part of the culture of soccer, is to use your head as well as your feet, right? And so they always practice hitting their heads, and so the practice is a part. The process of injury is a part of the routine to play the game, and it's a part of the culture to be. It's a part of the culture to be the best at that game, and so you'll likely minimize the efforts to protect yourself from this when you're playing the game. Yeah, thank you so much. Appreciate that. Yeah. Okay, let me see the next one. Okay, so let me see here. We have Laura here. Um, do they have new helmets for football? I think they're on trials now. Players don't always like the appearance of the new helmets. I can imagine the newer helmets that track blood pressure, oxygen saturation, videos, cameras and things like that. Maybe the social media aspect of new cameras that were connected to the internet, cameras connected to their own platform. Um, Maybe the benefits of self-marketing would encourage the patients the players to abandon head butting and just use their heads for photos and for marketing, things like that. Maybe you can switch the interests because these are young kids. Okay, let's see here. Uh, okay. Dr. Liv. Okay, sounds good. Okay, we're at 35 minutes now. I didn't want to go too long, but hey, if you don't have any other questions, then I think I'm gonna start signing off now. So before I leave, any other questions that you guys have? And if not, then I'll be opening my new clinic on the first floor and also the online clinic. And if you're interested in working with me as a medical doctor, family practice, or internist, I'll be glad to work with you. We have just a full practice of patients. And I'm looking to bring in more healthcare providers to the area so that my patients can have more more doctors to see. So if you're interested in working with me, just hit me up and we'll take it from there. For my patients, if you need to get in touch with me, please do. You can always contact me directly. Just text me first. If there's anything else I can do, it's my pleasure. And Read out. I hope that everyone enjoyed this. Take care of yourself. Read out. Ciao, guys.